Ever taken a hard hit to the head and thought, it's probably nothing? Well, think again. Head injuries can sneak up on you with symptoms you don't even see coming. What starts as a simple bump might actually be something more serious. Knowing what to watch for and how to respond can make all the difference. So, let's dive into the crucial facts about head injuries that every one of us needs to know. What exactly is a head injury? A head injury can be as mild as a bruise on your forehead, or as severe as a skull fracture. These injuries range from something you can shake off in a few hours to something that might cause permanent brain damage. When we talk about head injuries, we're covering everything from minor bumps to traumatic brain injuries, also known as TBIs. In a TBI, the brain itself gets injured, and this can happen from direct hits or even violent shaking. Think of the brain as a soft, sensitive organ protected by a strong shell, the skull. But even the toughest shell can break. Hard impacts, whether from a fall, a car accident, or even a sports injury, can damage this shell and put the brain at serious risk. What causes a traumatic brain injury? A traumatic brain injury usually happens when an object makes direct contact with the head or forces the brain to jolt inside the skull. For instance, getting hit by a fast-moving ball, falling from a height, or even a car accident can all result in a TBI. Another common cause? Violent shaking, often seen in cases of whiplash. When the brain gets jolted or hit, it can bounce, twist, or even bleed. In these moments, blood clots, or intracranial hematomas, itch, can form. Itch varies in severity and can either dissolve on its own or require surgery to remove. The problem is, you often don't see any visible signs until it's too late. The takeaway? Even if an injury doesn't look severe, it's best to treat it as though it is. How does a concussion fit in? Concussions are the most common type of TBI, yet they're often misunderstood. When a concussion happens, the brain's regular functions are disrupted temporarily, but they usually recover over time. A concussion can happen without a single drop of blood, making it tricky to recognize. That's why it's essential to understand the symptoms and act quickly. Spotting the symptoms of a head injury. 1. Mild head injuries. Slight bleeding or bruising. Mild headaches. Nausea or light dizziness. If you experience these symptoms, you're likely dealing with a mild injury. Most people shrug off these signs, but they can develop into something more. It's worth keeping an eye on yourself. 2. Moderate head injuries. Short-term loss of consciousness. Confusion or feeling foggy. Vomiting. Memory issues. These symptoms might show up soon after the injury, or they may take a few hours. They're not something to ignore. If you experience any of these symptoms, it's essential to see a doctor right away. 3. Severe head injuries. Major bleeding. Passing out and not regaining consciousness. Seizures. Clear fluids leaking from the nose or ears. Numbness, weakness, or loss of balance. These are your red flags. If someone around you has any of these symptoms after a head injury, it's time to call emergency services immediately. Severe head injuries can be life-threatening, and fast action is crucial. 4. Concussion symptoms. Confusion and difficulty concentrating. Headaches and nausea. Sensitivity to light or noise. Balance problems and blurry vision. Concussions can be tricky. Symptoms don't always appear right away, sometimes taking hours, days, or even weeks. This delay is why it's important to monitor any head injury closely. If you start feeling foggy, nauseous, or just off, don't brush it off. Seek medical advice. Diagnosis: what will a doctor do? If you suspect a head injury, a doctor will start by asking questions about the injury itself, your medical history, and the symptoms you're experiencing. They'll likely do a physical exam focusing on the head, face, and neck. Doctors often use the Glasgow Coma scale to assess the injury's severity by rating the following: eye movement, communication abilities, motor skills, For more severe injuries, they may order a brain scan to pinpoint any hidden damage. In some cases, this diagnostic step is crucial for proper treatment and recovery. First aid for head injuries. While a mild head injury may not always require emergency care, there are a few essential steps you can take to help with recovery. Apply a cold pack to reduce swelling. Rest for at least 24 hours and ask someone to check on you regularly. Avoid alcohol, drugs, and strenuous activities for a few days. Skip contact sports until you're cleared by a doctor. If symptoms last for more than 2 weeks, consult a healthcare provider. And for moderate or severe symptoms, don't wait, seek medical help immediately. When to call emergency services. If you notice someone with severe symptoms, call 911 or your local emergency number. It's important not to move someone with a severe head injury, as this could worsen their condition. If they're wearing a helmet, leave it on unless instructed otherwise by emergency personnel. Taking preventive measures. Head injuries aren't always preventable, but you can take some steps to lower your risk. Wear a helmet when biking, skateboarding, or riding a motorcycle. Buckle up when you're in the car. Follow safety guidelines when playing sports. Remember, the brain is a delicate organ. Taking precautions, no matter how small they may seem, can help keep your brain safe. Why it's important to take head injuries seriously. Head injuries can have long-lasting consequences. A bump to the head may not always be just a bump. Even if you don't feel any immediate symptoms, it's smart to watch for changes. If you feel confused, nauseous, or like something just isn't right, don't hesitate, talk to a healthcare professional. Protecting your brain is vital, and acting quickly in the event of a head injury could save your life or the life of someone you love. Remember, there's no shame in being cautious. Better safe than sorry.